Chief, what causes smelling mouth?
All right. There are a number of things that causes the mouth to smell. A number of things. Most times patients will call and be asking, "I'm having smelling mouth. What can I do?" You know, in order to treat that smelling mouth, we need to know the cause of it. Now, I want to mention about three, four, or five causes of or likely causes of smelling mouth. Number one is what we call dental caries. Dental caries, in a layman understanding, is tooth decay. When there's hole on your teeth, remember, we call it tooth decay. So if we call it tooth decay, it means that it has decayed. So what do you expect of something that has decayed? Smell. So that is number one. So if there is tooth decay, there's every likelihood that the mouth will be smelling. Then number two thing is what we popularly call gingivitis or periodontitis. That is when there is an issue with the gum region, your gum region, when there is issue there, when there is wound there, so it's decayed somehow, there is wound. So in such case, there is every likelihood that the mouth will be smelling. Another one is the one that is seems most common anywhere, poor oral hygiene in form of dirt, calculuses, stains on the teeth. In such case, the mouth will be smelling until those calculuses, stains, and debris are removed. That is it. And then there's another one that that happens because of the diet we eat. The diet we eat. Diet like ginger, garlic, onga. All these things have peculiar smell. So when you choose such things, it might likely smell. And then another one is early morning breath. Most times if you don't brush your teeth a day before or a night before sleeping, there's every likelihood that when you open your mouth will be smelling because of the food particles that are left, that are decayed on your teeth. You understand? And then there's another one from the system. We call it halitosis from systemic origin. If there is any issue within your alimentary canal, when you talk, it tends to come out something like ulcer within your alimentary. In such case, we after diagnosis, we may refer to a physician for follow-up. Once all these things is done, you'll be fine. So to recap what I've said, mouth smelling does happen because of one thing. There are a lot of things that causes it. Number one, when there's tooth decay, that is hole in your mouth. Number two, when there is wound on any part of your gum. And then number three, when you eat some certain type of food or diet. For example, garlic or ginger, and you should know better. And then when there are tests on your teeth, just to mention but there are many other causes of it. Thank you.